Hello, hello, hello. I am very happy to talk to you today. I'm going to try to stay on topic. Today, we are talking about sarcoidosis, but to be completely honest, I'm really upset about COVID today. I've just so many stories about it affecting people that I care about, and it's just upsetting for me. And I want my vaccine already. I'm chronically ill, and it's not available to me. I know there's a part of me that says that I need to be grateful, right? Because they pushed it through so fast. And it is miraculous that we have these vaccines available. However, at the same time, I need it, and I need it now. So, yeah. I don't know if you guys feel that way, but that's how I'm feeling. That COVID is so scary because you have it, and then some people are like, well, it wasn't that big a deal. It was just kind of like the flu, and then it's over. But then it's not, right? It's not over. You can get this long COVID, or you can have symptoms afterwards and have to go to the hospital, and bad things happen, and it's scary. And I just don't like it. I just don't like it at all. So that's where my spiritual beliefs come in. I know a lot of people use Christianity. I like to do stuff that's a little less mainstream, but whatever kind of spirituality you practice, I think that's where it comes in, when it just feels hopeless and difficult and you need something. Anyway, thank you for listening to me vent about COVID. I cannot wait for a day when we don't have to stress about COVID, and then we can have a party. Woo! Okay, so I'm wearing my sarcoidosis t-shirt. This was purple. And I wanted to talk to you about testing. Because honestly, with everything, having the sarcoidosis, having the diabetes, and all the other crap I have that I can't even always remember, the ongoing medical care sometimes feels like such a burden. I feel like I am done. I don't want another needle. I don't want another test. I just want to live my life. But we don't get that option, do we? So I wanted to talk to you about what it's like doing all the testing ongoing. So I was diagnosed with, let me get my diagnosis right, sarcoidosis, July of 2017. So that's the one diagnosis that we're going to talk about today, sarcoidosis. And to get diagnosed was quite the challenge. I was too tired to do my job at work. I was looking for doctors to give me that magic pill so that I could go back to work. I actually love my job. There were some people that joked around about being jealous that I don't have to go to work anymore. But I'd much rather go to work than be sick. And I think most people feel the same way. So I was looking around, and after going to the ER several times, I was sent to a heart rhythm specialist where I was diagnosed with dysautonomia. And I was like, what? And he said, dysautonomia. He had to spell it for me 3 times, and then he finally wrote it on a piece of paper and handed it to me and said, go Google it. My brain was just repelling the information. It's like, I don't know this big old word, and I don't want it in my body. So we had previously lived in Rochester, Minnesota for 8 years, where my husband went to the Mayo Clinic. My husband is chronically ill. He has multiple venous malformations. And at the time that we moved there, that was way back in 2003, he was having strokes. They were TIAs, so mini strokes, but he was having a lot of them, and he did get some brain damage, and we weren't able to find anyone to help him with his condition, which is why we ended up in Minnesota, and they were great. They were great for my husband's condition, okay? So I made an appointment to go to Minnesota to see a dysautonomia specialist and learn more information about dysautonomia and how do you control it. Well, I get there and their system is amazing. I saw like 30 doctors in a 10-day period and got all kinds of testing done. And they said, with me, I'm so weird. Most of the time, I can't get clear diagnoses. The most common form of dysautonomia is called POTS, postural orthostatic tachycardia syndrome. And they couldn't diagnose me with that. But they did say I had orthostatic intolerance, which means my body doesn't like standing up, which is why I use a walker, because I can't just be standing around, especially lines. I don't do lines. I need to sit down at any moment. And so while I was there, I was diagnosed with small fiber neuropathy in my hands and feet and genitalia. And I saw a rheumatologist where I told him, I think I have Sjogren's. So he did a chest x-ray looking for, can't remember what he was looking for. I'm so sorry. I can't remember. I'm sorry. One of my symptoms. I just can't remember. And so he did not find that, but he said, it doesn't look right. You need to see a pulmonologist. And I wanted to see a pulmonologist now, but I could not get into a pulmonologist before I needed to fly home to Utah. So I had to come home and then find a pulmonologist here. And they wanted a referral. So I had to get a referral and get them all my medical records from Mayo. And then she's like, oh, looks like you need bronchoscopy, where they stick a needle in your lung and get a little test. So she said, I can't do that. We're going to have this other doctor do that. So he looked at my chest CT and said, first, we want a PET scan, which is, I don't really know a great medical way to describe it, but I'm going to describe it my way. It's radioactive, and they put sugar in your body so that wherever you have inflammation, it lights up. And then they put you in a CT machine, I think. I don't think it's a different machine, but maybe it is. And so we did that. And the test showed that I lit up all from my lymph nodes, all down my spine, up my neck, down into my groin, and all over in my lungs. And that report said it could be lymphoma or Castleman's disease or sarcoidosis or something else. And I was like, great. I haven't even heard of Castleman's disease. So then that surgeon, I never even met him, because after looking at the PET scan, he called me and he's like, okay, I can't help you. You need to see a cardiothoracic surgeon. So I saw the cardiothoracic surgeon. He did the surgery. That's why I have this scar, is a mediastinoscopy. They go down behind your breastbone, and he biopsied all the lymph nodes in my chest and up in my neck. And I guess they had a technician right there that was able to look at the granulomas under the microscope. So when I came out of anesthesia, the surgeon said, congratulations, it's sarcoidosis. I didn't feel the congratulations. Maybe he could have said, congratulations, you don't have lymphoma or Castleman disease, whatever the heck that is. But I don't think congratulations and sarcoidosis go together. I think it should be more like, you have sarcoidosis and it looks like it's chronic and systemic, and you're going to have to deal with it probably for the rest of your life. And I wish you luck, and I wish you strength to get through this battle, because it is a big battle. That would be an appropriate thing for that surgeon to say. I should go tell him, huh? Anyway, so that was way back in 2017. And since then, I have in that PET scan, I should tell you, I had an allergic reaction to the iodine, which was terrifying. And I have an uncle that a few years prior to that had died of that same exact thing. He had an allergic reaction to the iodine and he died. And so the way that you really monitor sarcoidosis is with chest CTs with iodine. They say without the iodine, it's like looking around a dark room without a flashlight. And I'm like, I don't care. I don't want to die from iodine, so you're not putting iodine in my blood. So I mostly haven't let them do CTs because they don't want to do them without the iodine, and I'm not doing the iodine. I've had lots of blood tests over the years, but I'm a rare case with my sarcoidosis does not show up on the blood tests. All the inflammation markers come back normal. My diabetes has continued to get worse, but that's a different story. And trying to think what other tests that have been done, but I can't think off at the top of my head. So now recently in 2020, my neurologist, who was my favorite part of my team. So my team consists of my primary care doctor, a neurologist, the heart rhythm specialist, a dermatologist, an ophthalmologist, and then I saw a nephrologist, I see an endocrinologist, I see a gastroenterologist, I've seen a podiatrist, and if there's anybody else, I forget them right now. But the most important ones are the ones I listed in the beginning. So the neurologist had gotten me on IVIG treatment, and that was helping with my neuropathy. And the neuropathy, he believes, is because I got the sarcoidosis in my peripheral nervous system. Well, he moved to North Dakota because he's an MS specialist, and they have this amazing MS clinic out there where he was going to be able to go and work and only take care of MS patients. So that was freaky scary at first, but it turned out to be a good thing because he got me in to see Stacy Clardy at the University of Utah. And honestly, she knows more about sarcoidosis than anyone that I have talked to. My pulmonologist, Dixie Harris, she knows a lot too, but I think Stacy Clardy knows even more. So it's been pretty awesome. I saw her this past October, and she set me up for more tests, which have all taken place this month in January because I procrastinated them. I didn't want to have them done. I am chronically dehydrated, so I get 2 liters of fluid. That's why I have this port here. I get 2 liters of fluid twice a week because of dehydration. And then, I'm dealing with the diabetes, with the insulin pump and everything. And I had surgery last July, and I've been losing weight and trying to figure out what to eat, what not to eat. It just felt like I don't want to go do all this testing. But I also want to benefit from this doctor that knows what she's doing. And in order to do that, I have to do what she says, right? So I'm going to tell you the timeline. And then I'm also going to tell you a little something about my husband because it made this journey more difficult. With his multiple venous malformations, I guess I should do another video about that. But on the left side of his face, he has a malformation that's closing off his eustachian tube. That's the tube that goes from your ear to drain into your throat. And so he went to an ear, nose, and throat doctor back on September 28th. So the day before I saw Dr. Clardy. And then on October 12th, he went back and they put a tube in the ear. The idea was the tube was not going to do anything with the malformation, but it would open a little hole in his tympanic membrane to release the pressure so he'd feel better. Well, he went back to see him again on the 21st, and his ear was super infected and had pushed the tube out of the hole. So the doctor cleaned up the infection and put in a new tube. And then Antar went back to see him again on the 28th. And I think he got more antibiotics. And then he went back to see him again on November 11th. and found out it was still infected. And he gave him more antibiotics and more ear drops. And then he went back on December 14th and he's like, wow, your ear just does not like these tubes and it's really infected and there's this really big hole. So I'm gonna have to send you to a surgeon. So that gets us to January, okay? So, actually, I'm gonna tell you, December 28th, I had this bright idea. I'm gonna cure myself with raw vegetables. So I started a raw vegan diet. So, newsflash, I'm not cured yet. I have not given up hope. You remember how we talked about that spirituality in the beginning? We all need something to give us hope, right? And right now, raw vegetables give me hope. So that I started that. And the reason I tell you that is because changing your diet is an additional stress. Okay, so then the 29th, I had an infusion, and Antar had 2 doctor's appointments. The 31st, I had an infusion. Then we get into January. January 4th, Antar had his meeting with the ear surgeon. And then that afternoon, I had a meeting with my home health nurse. They have to come and recertify you every 6 weeks or so. Then on the 5th, I had an infusion and I had to get a Tdap vaccine because I turned 50. And when you turn 50, they treat you like a little kid and you have to get a bunch of new tests and vaccines done. Then on the 8th, I had an infusion and I got my shingles vaccine. And then I had physical therapy that day. And then on the 11th, I had a cardiac PET scan. Let me tell you, that thing is not a piece of cake. So it takes several hours and they do a chemical stress test. And let me tell you, if you ever have a choice between getting on a treadmill to do a regular stress test or doing the chemical stress test, I recommend getting on that treadmill no matter how hard it is. That chemical stress test made my head feel like it was going to explode. It was awful. I did not like it. It made me feel sick. And while I was having that done, Antar had another doctor's appointment. On the 12th, which is the following day, I had another infusion. And on the 14th was Antar's ear surgery. It took a lot longer than we planned. They opened up behind his ear so they could flip his ear forward. And then inside his ear, the opening wasn't big enough and it curved funny. So they did some plastic surgery to open up his ear canal so they could have room to work. And then they got in there and there was a lot of chronically inflamed tissue that they had to take out. And he had gotten otosclerosis from having the hole in his ear for so long. So there are 3 little bones that make it so you can hear. They had to take out the middle one. It's called an incus, and replace it with a prosthetic. And then they took this little cartilage right here in his ear and used that to make a new tympanic membrane. And it was a big deal. It was a big deal. Big surgery. Yeah. So from that day till now, I've been taking care of him. It's kind of different because he's been my caretaker most of the time because I've been sicker than him. Well, right now it's the other way around. He is sicker than I am, so I'm his caretaker. I have to take care of his big dog, and I have to feed Antar and give him his medicine and put the drops in his ear. It's a lot of work. It's a lot of work. And then the 15th, I had my infusion, so I don't get dehydrated. And then the 18th, I went to see my neurologist. The 19th, I had an infusion. The 20th, Antar went back to have him check on his ear, and they had to take out a bunch of the packing. And then, there was a lot of blood, and it was awful, and he was miserable. It was really sad. And then I had to leave him here because I had to go have physical therapy. Okay, so the 21st, I had a regular PET scan. So this was a question I had. I just had the cardiac PET scan. On what day was that? The 11th? Why do I have to have another PET scan? So they do it a little bit different. It is a little bit different. It seems inefficient, but it's a little bit different. The cardiac PET scan did come back saying my heart was absolutely gorgeous. There's no plaque. It's just beautiful. And I think I attributed that to the vegetables. I think the vegetables really worked in cleaning out my heart. So then I did that other PET scan on the 21st, and it shocked me because it found no evidence of inflammation in my lungs or in my lymph nodes. So then I ask, well, if there's no evidence of sarcoidosis in my body, why do I still feel like shit? I am so fatigued. Yes, I'm doing better. I'm well enough to take care of my husband and get up and make breakfast every morning. And I need to be grateful for those small things. But there's a much bigger part of me that's like, hey, if you can't see sarcoidosis on any blood test and you can't see it on a PET scan, then I should feel amazing. That's what I think. But that is not the reality. So something else that I forgot to tell you about Dr. Clardy. For the 2 years before I was diagnosed with sarcoidosis, I had one infection after another. I had pneumonia, I had urinary tract infections, I had sinus infections. I actually ended up having a sinus surgery because I was just constantly having sinus infections. And then with my sinus infections, he couldn't just give me a prescription. It was done. He had to actually biopsy the infection and have them make a special antibiotic just to kill my infection because my infection was so unique. And anyway, Dr. Clardy that I saw back in October, she said that sarcoidosis doesn't do that. Now, I didn't know whether to believe or not, but she said Sjogren's does. She believes that I have Sjogren's. So in March, I have an appointment to have a lip biopsy. Now, remember back in 2017, and I told that rheumatologist, hey, I think I have Sjogren's. I wish he would have followed up on that. So that taught me something about medical clinics. So the Mayo Clinic is amazing for several things. It is amazing for my husband's malformations. It is amazing for anything to do with the heart. I think it's amazing for anything to do with the brain. It's probably amazing for a bunch of other stuff that I don't know about. It has not been amazing for me because I lived there for 8 years with sarcoidosis, I believe, and I was never diagnosed. And my children, I have 2 girls that have POTS, and the one, she started passing out in Rochester in middle school, and she was hospitalized several times. She never got diagnosed. And that is something, if you have dysautonomia or POTS, you don't want to see just any neurologist, even if they're at the Mayo Clinic. You want to see a dysautonomia specialist. So the one that I got my daughter finally into is Brent Goodman in Scottsdale, Arizona. And he's amazing, and he's taking care of her care now. She lives in Arizona. So yeah, with everything I've learned about sarcoidosis and Sjogren's, the best place, now I could be wrong, I've never even been there, I could be just fantasizing, I think it's the Cleveland Clinic. I wish that I had gone there first. And some days I wish I would just go there. But I am fatigued financially, physically, emotionally from all these doctors and all this running around. So one more thing I have to tell you about my PET scan. They found a lesion on my thyroid. And that kind of stressed me out because that's something I've never seen before. I'm hoping it's just sarcoidosis. The women on my father's side of the family have thyroid issues. I have aunts and cousins that have thyroid issues. My grandmother on my mother's side had her thyroid was enlarged and got removed. My mom thinks that was related to her leukemia. I don't know. I just don't know. But there's a part of me that's like, really? Do I need one more thing? Do I? Do I? No, I don't think I need one more thing. I think I just need to get well. But you hear my throat's getting all scratchy. Sjogren's would explain that. I have to put eye drops in 4 times a day. Sjogren's would explain that. I choke because my throat is so dry. Sjogren's would explain that. My vagina is so dry that I can't have intercourse even with lubricant. Sjogren's would explain that. And so there's a part of me wants it to come back negative because I don't want to have Sjogren's, and there's a part of me that would like to have some answers, because don't we all like answers? All right, I'm just going to finish out January here. So then on the 25th, I went to physical therapy. On the 26th, I had an infusion. On the 27th, Antar went back for his ear. They removed the last of the packing. And he has this weird thing that you have crystals in your ears. Okay, I'm going to lose you. You're going to think, oh my gosh, this woman's nuts. You have crystals in your ears. I think it's in the cochlea, and they maintain your balance. Well, my poor husband has had a problem with the crystals in his ears for years. He has a lady he knows on a first name basis. Her name is Lynn, and she fixes his crystals like every 6 months. Somehow the surgery knocked his crystals out. And so while he's trying to heal, he's dealing with this horrible dizziness. It's awful. I just feel so bad for him. But the physician's assistant that works with this surgeon is amazing at fixing crystals. She knows how to maneuver people to put them back. Because what you do is you literally move the person in a certain way to rock the crystals and put them back where they belong in the ear. It's really nuts. It sounds cuckoo. It sounds made up. But I know it's true because it happens to my husband. And then on the 29th, I had an ultrasound on this lesion on my thyroid. Yeah. So their recommendation is a fine needle aspiration. I'm not excited to have a needle stuck in my throat. And who is going to do this? Who is going to put this needle in my throat? So Wednesday, I go see my primary care doctor, and I'm going to unload on her and whine about how difficult being chronically ill is, especially when you have chronically ill husband. And I'm going to ask her, who do we have do this fine needle aspiration? Do I call my endocrinologist? Wouldn't an endocrinologist be the one that would handle the thyroid? I've decided I'm just going to wait till Wednesday and talk to my doctor, and we're going to figure this out. So, what is the moral of this story? Did I just make this video so I could dump on you guys? I hope the message you get is that you're not alone. That when you have a chronic illness, it sucks. I don't know if I'm allowed to swear on YouTube, but I would if I was sure. Yes, it sucks bad, really, really bad. And so you just have to do your best to make the best of it. Bring as much joy into your life as you can. I like to have a cup of something. Look at this. It says I'm magic and it has a unicorn. And if I have a cup of coffee or tea, this is full of peppermint. And I'm like, you know what? This makes me feel special. You might be thinking, hey, it's just a mug, lady. But if I have a mug, whatever I'm doing becomes a ritual. It becomes sacred. So this has now become a sacred ritual YouTube video because I am holding a mug that says that I'm magic. So we just do what we can to get through it. I'm an advocate for people with sarcoidosis. I'm an advocate for people with dysautonomia. And I like to help people, and I like to help people know that they're not alone. And I hope that I'm making a difference. And this is not all just a bed of roses. And look, I spent 30 minutes, and I didn't even tell you all the crap I go through. But yeah, I love you guys. If you suffer from any of the stuff that I mentioned, reach out. If you just need some support, reach out. I have a page on Facebook. It's Positively Susie. We have the Utah Sarcoidosis group on Facebook. And I'm going to try to be more active on Instagram. It's hard for me to spread outside Facebook. I've just discovered TikTok. Would that be helpful? Please tell me if TikTok would be helpful. And for last little plug, this is just about my spiritual stuff. I have a Patreon account now, although yesterday I found out it's a little messed up, so maybe this announcement's premature. But if you want to join me on Patreon, I'm going to be doing little videos, much shorter than this, about spiritual gifts and entourage and tarot and all of that little fun stuff that helps me get through all this crap. All right. I love you guys, and I hope you have a beautiful, wonderful, fantastic day.